Health and Protected Areas Commission working on this topic on behalf of our colleagues across Europe. And we'll hear a bit more about that in the webinar. And the EUROPARC Federation works to improve the management of protected areas in Europe, and we do that through international cooperation, and this webinar couldn't be any more international. We very much thrive on the exchange of ideas and experience, and we want to influence the policy and practice in the work of protected areas. And we believe perhaps that we are the largest network of protected areas in the world. We have over 400 members who represent thousands of protected areas and parks across 38 countries. And that's all different kinds of parks and protected areas, European Natura 2000 sites, national parks, regional and nature parks, peri-urban parks. Really, we are a wide and thriving, healthy network. But what underpins our work is that we are dedicated to the practical nature conservation and sustainable development of Europe's protected areas. And we foster that holistic approach to our land and seascapes through networking, by advancing policy and practice, and through developing new solutions for protected area management. And of course, it's important to us to support the work of our parks and protected areas, and particularly through capacity building. And one component of that capacity building is our extensive webinar programme, which you can see here, many of the previous webinars. Now, they've been recorded, and you're welcome to revisit these at your leisure through our website. And of course, a further aspect of supporting our parks and protected areas is to communicate the values and benefits that parks and protected areas bring to our wider society. And one of those very important benefits is, of course, that which nature provides for our health and well-being, and of course is the topic of our webinar today. So in a few moments you'll hear from our 4 speakers with a wide range of experience from across the globe, in fact. But just as a reminder to that which Barbara mentioned at the beginning of the webinar there, we're very keen to have your interaction on the chat box on the right of the screen. Please feel free to put your comments there and your questions. Identify who you are and where you're from. And please make sure that when you put your question there that you indicate which speaker that question is addressed to. And I'll be gathering up your questions and addressing them to the speakers after all the presentations have taken place. So just to begin then, I'll be handing over to Pete Rockcliffe from Scotland. Now, Pete's day job is to be part of the Scottish Natural Heritage national team, which includes the promotion of health and well-being, and it's about people's connection to nature. But he also finds time to be the chair of EUROPARC's Health and Protected Area Commission, as well as being a member of our EUROPARC Council. So Pete, I'll hand over the chair of the remainder of the webinar to you.
Thank you, Carol. As chair of the Health and Protected Areas Commission for the EUROPARC Federation, can I just say how great it is that so many people have joined this webinar today, and from all over Europe and different parts of the world. And again, that shows the growing interest in this topic. Also, a big thank you to colleagues at Parks and Wildlife Finland for helping us host this webinar and the Commission over the last few days. In developing our thinking and work plan in the Commission, we've been really focused on producing work that is relevant to EUROPARC Federation members and can be used by the many park managers in the network. And one of the key outputs to date has been the new toolkit, which I hope you've all had a chance to look at in the run-up to this webinar. But I'm going to spend a few moments just going through the toolkit and explaining what's in it, before we get into the case studies from the 3 presenters, which will look at some of our aspects of good practice in more detail. So what's in the toolkit, and why have we done it? It's supposed to provide practical guidance to help national parks and other protected areas contribute to the delivery of health outcomes. It's structured into several sections, and these look a bit different. It's an online toolkit, but it's also a PDF toolkit, and so how this is produced in practice looks a bit different, but basically the structure contains a set of key messages about health and nature. It looks at some of the emerging policy frameworks that we have for health and nature in different nations and regions of Europe. It looks at some of the key sources of evidence. It provides links and presents a number of case studies, both old and new, about the really exciting range of work that protected areas are doing in this area. And it provides a checklist, a sort of a basic menu of things that we feel are really critical to delivering health outcomes within a protected areas context. And we do have a sort of ambition in the Commission and in the EUROPARC Federation about developing this toolkit to encourage use of nature as core business in both the environment and health sectors for producing health outcomes. There's been a long-standing interest in the role of protected areas in promoting health and well-being, most notably in terms of various IUCN working groups and the Healthy Parks, Healthy People programme developed by the Australian, US and Finnish parks. We'll hear more about the latter two shortly, I think. And in the toolkit, we've distilled some of the general principles for what is known as the Melbourne Communiqué, which tries to capture the essence of this work. Basically, the language of the communiqué is a bit dense. We're looking for three objectives from our connection with the health sector. More health benefits for people from protected areas, nature valued more in health and policy practice, and well-resourced and effective protected areas. There is a virtual circle in there that we're trying to promote, very much in keeping with EUROPARC Federation philosophy about sustainable nature valued by people. All this, of course, is based on the assumption that contact with nature benefits people's health. And the good news is that there is now good, and in some cases, in the words of Scotland's Chief Medical Officer, compelling evidence that access to the natural environment can help guard against, treat and manage key health conditions such as depression, coronary heart disease, stroke, type 2 diabetes, obesity and dementia. For us in Scotland, mental health is one of the key issues at the present, and the evidence there is particularly strong around the beneficial impact of contact with nature, experience of nature in a variety of habitats and settings. So Europe's nature is a health promoting asset, and our national parks and other protected areas are key tools for unlocking this. In the toolkit, you'll find links to recent and relevant reviews and summaries of this evidence. But this is a vast area of research at the moment and rapidly changing. So I'd like to hear from you if you feel we're missing any key material here, or you'd want other material to help you deal with this issue. So how do parks and other protected areas turn these principles into practice? The toolkit focuses on three key areas which can help unlock this potential. Areas of policy, partnerships, and innovation in good practice. And these are detailed in the slide in front of you. Focusing on the policy aspects. We have good practice in Europe, with several countries leading the way in developing national approaches and policy frameworks. And perhaps there's no surprise that in the Commission we have strong representation from Scotland and Finland, where we have two very different and contrasting approaches being developed. One in Scotland, focusing on what we're calling the Natural Health Service, which is wider than protected areas and includes all of the natural environment, but within which protected areas and green space have a really important role to play. And in Finland, we have an initiative based on the Healthy Parks, Healthy People initiative programme, the global programme, which a speaker will talk about shortly. There's also an exciting range of good practice And looking at the panel on the right, the box, there's lots of countries here represented, and there'll be lots of good practice in these countries. There's a key message for me today, which I'll repeat later. It's about, a lot of this is about simply good practice in protected areas management. And the previous work of the Commission, we developed a few case studies, some of which are illustrated here, and we've been in the process of developing further case studies, and we're still in the market looking for more. So perhaps we'll have some discussion about that later in the day, in the webinar. And finally, and this is really the heart of the toolkit for me, is this checklist of the elements of work needed to deliver on the health and wellbeing agenda. And I hope each of the speakers that follow me will be talking about this in more detail. So the toolkit talks about these elements, including strategic planning, how you fit the park management into a wider policy context, but also the detail of the park management itself, the planning. You've got the detailed site management of visitor facilities, etc. You've got specific outreach projects which have particular health outcomes. You have a key role for communications. Well, I've been working in this area for some time, and it still amazes me that when we speak to health professionals, we speak a very different language to them. So the way we communicate to the health sector, the way we communicate to the public is really important here. We also need to be able to demonstrate the contribution we're making to health. So monitoring and evaluation of visitor numbers and the health impacts arising from their use and contact with nature is also important. And there's a really good example from meta-analysis in the toolkit at present. And again, it'd be interesting to know whether there's others out there across Europe and elsewhere that we should be looking at. And finally, there's a key area around staff training. Do we have the staff who have the skills and the language to talk about health and also to communicate that with health professionals? So they're the basic elements of the toolkit, and the next three speakers, I hope, are going to explore this in more detail, aspects of these in more detail. So some headline messages to end my bit with. As I've said, a lot of this work is really about our bread and butter as protected area managers. The important thing is about making the connections in policy and practice to the health sector. Whether that be the national health agencies or the local GP practices. There's a range of partnerships that we need here. The toolkit is now available as a PDF to print, as well as look up online, so please do make use of it as best you can. We've clearly welcomed feedback on the toolkit. In the Commission, we had a discussion about whether we should make it better before we launched it, but we decided to get it out there because we want to see it used and therefore improved. So feedback is essential to that. And finally, as I've always been doing, plug, if you have good practice, and I'm sure many of you listening will do, please get in touch, either with one of the members of the Commission, you'll find the details as part of the webinar package, or you can submit a case study online, and we'll come back to you on that. Okay, thank you for listening to me. Now it's my great pleasure to introduce Robert. From those of you who've managed to look at the bibliographies provided by all the speakers, Robert's got an incredible amount of experience in parks and natural resources field in the US, over 4 decades, so I can barely give him justice. And I can encourage Robert to probably say a few words about where he's come from and his journey in park management. He's currently serving as a general manager of the East Bay Regional Park District, which is the largest regional park system in the US, with over 1,000 employees, serving 25 million visitors per year, with 75 free parks on over 121,000 acres. So this is hopefully a very strategic approach that he's going to talk about here. So with that, I'll hand over to Robert.
Thank you, Peter, very much, and good morning, everyone from California, and more particularly the Bay Area, San Francisco Bay Area, where we all very much move on. We have 55 miles of San Francisco Bay Shoreline. It's urban, heavily populated, and that shoreline area is a place where most of the urban population resides who are going to be affected by climate change, but are also very much active in our parks because they are so close to nature nearby. Our system was developed 85 years ago. It is an independent government. It only addresses parks, recreation, nature interpretation, fishing, all the outdoor activities you would think a national park or state park system would have. We partner regularly with the national park system, which has a wonderful national park in the Bay Area called the Golden Gate National Recreation Area, and it is now the heaviest used national park in the nation, and it serves a very, very important city by the bay, San Francisco. We also partner with State Parks of California, which includes operating several large state parks within our area. And we partner with a lot of NGOs, a lot of nonprofits who conserve property, who do education programs, and who raise money to acquire protected lands. So very active in the East Bay and San Francisco Bay Area. The Bay Area is headed towards 9 million people, so it is a very big population as a metropolitan area. We started Healthy Parks and Healthy People coming from a conference in Australia, brought it to the Bay Area, and have made that and adopted that as our own and adapted that to serve the populations that are in the Bay Area. We have an economic resource here in the parks that provides $4 for every dollar invested as an economic engine that drives East Bay, and that has been a very successful study we did last year. The economics of parks in the East Bay, that is a formal economic study, and that is also available. And we have really tried to reach out to underserved communities. And as you will all know, underserved communities have some of the biggest health challenges. So what we have tried to do is work with our local health agencies, with hospitals, which I'll give some specific examples of, to figure out how we communicate better. What we all know in the park business is true, that parks make life better and they make life healthier. But we're also trying to be a bit selfish for our own purposes, to be able to say we also need to keep the parks healthy. So a combination of healthy parks and healthy people is a perfect partnership, because we need for the public to realize that when they're in a park, they're not only enjoying the park, its beauty, its wildlife, but also enjoying their health benefits. And so that is something that's been a bit of a challenge in starting this in the Bay Area, because to some degree, the medical community, the doctors, the practitioners speak a different language. And I'm not saying Latin for prescriptions. I'm saying that park people are really talking about wildlife, talking about natural history, and doctors are talking about medical practice as professionals. So a big part of what has happened is to bring the two communities together in a dialogue of how we better communicate and educate both sides. The regional park district is a huge, vast system in California. And again, 85 years of growth. We continue to grow. We continue to be a major conservation agency, but we're also looking at programmatic work. So we started with the partnership for looking at how we can address some of the chronic problems of obesity. We know that physical activity is key to everyone's health, but how do parks contribute to that? We know intuitively, again, that parks are it's where we exercise, it's where we go with our families, it's where we relax. But we wanted to bring that further. So our studies have been pulled from other areas, including Australia and around the world, about how we can address these chronic health issues, reducing the impacts of high blood pressure and diabetes. We were the first agency to initiate the HPH program, and we have brought that to the entire Bay Area, working with many other agencies. And our naturalists are trained biologists, wildlife experts, educators in the wonders of nature, but we needed them to talk in a language that directly looks at the health benefits as well. So to take a traditional outdoor bird walk with a naturalist and also try to get them to talk about the health benefits to get people in the parks, again, has been a challenge. So we started bringing in practitioners. It could be a yoga teacher, it could be a doctor, it could be a psychologist, to have 3 to 5 walk programs per month, approximately 45 programs per year, 5 to 10 people. I will just comment that it started with 5 to 10 people. It's now more like 20 to 30 people. So we team those walks with a naturalist, with a park naturalist, and with a practitioner in the health community. It could be any number of things. It could be dance. So this is how we have approached trying to bring people into the parks for the benefit of the system to promote the healthy parks, but promote health in parks. The Park District has initiated the cross-agency multicultural wellness discussions, which gave rise to HP in the Bay Area. And we have 20 public park and open space agencies who committed that each one of those agencies will sponsor in their own departments a walk in their park system at least once a month and promote that as a Healthy Parks, Healthy People Bay Area program. It has been very successful. We had included the national parks as a co-leader. They were our main partner, and that has been very helpful. What we've been able to successfully do is have many of the hospital programs, many of the health providers, a very large system. Kaiser Permanente is our very large hospital system in the Bay Area. We have a network of Healthy California. We have the San Francisco Department of Health. We have the Solano County of Health and Social Services. We have a lot of other county systems that are managing health. And so this is how we created this partnership. One of our biggest successes have been working with chronically ill children at the largest hospital system in the East Bay, which is the UC Benny Hoff Children's Hospital. Very excited about this. It is a very touching story about children who have had zero access to nature, zero access to putting their feet on a sandy beach. And so we actually brought the parks to the hospital with a mobile visitor center, a van, with nature in that van. And then we also would sponsor specific healthy walks as a park prescription through Children's Hospital, paired with a doctor. and brought them into several of the parks that are close by. And this is far deeper than just promoting healthy activities in parks. This is taking chronically ill children and highly stressed families who had never done anything but go to the hospital to treat their children. And it has been a very rewarding experience by our own staff, but also the doctors who are so heavily worked within the hospitals to get outdoors and to do activities in the parks. We developed a new program called Shine, and the Shine program has really allowed us to promote stay healthy in nature each day. So it's not about that once a month sponsored activity, but it's to take from that activity and through the hospitals to promote, you can do it to yourself. Here's for yourself. You can see how to get to the parks. We publish the maps. And very excited is that at Children's Hospital in Oakland, California, we painted the entire clinic full of park pictures. So if you go into room number 3349 and visit that doctor for appointment, you may be in a redwood forest. If you go to another doctor's room or the waiting room, you may be at Lake Chabot, a regional park. And we have provided the materials when they redesigned that clinic to provide all of these office visits. Rather than going to the room, you go to the name of the park. It is a unique and very special arrangement that we created. With our partnership with the very large Kaiser Permanente, we have been able to do multicultural wellness walks, monthly lunch hikes led by the Park District naturalist, and again, a health instructor. 6 walks per year. These are very large, 80 to 150 people participate. Over 3,200 have participated in walks since 2013. It is funded through the Kaiser Permanente partnership and our own foundation, which we have a nonprofit who is our partner through the Park District that helps raise money. We have brought what we call the Trails Challenge to thousands of people, which is to get outdoors. This is not a led hike. It is not a staffed hike. It is an individual challenge that we provide a list of trails, where to get there. You have a free hiking program that you can sign in online. You can receive actually a little prize for doing that. And we have brought that, and you get it. The prize is a T-shirt saying that you stayed healthy outdoors. So the Trails Challenge is both young people as well as adults. It is very popular. I really encourage this kind of idea because people do like to challenge themselves. They like to say, we participated, but we did it on our own time. The school programs have really been another very successful thing, which is 3rd grade students visit parks as part of science and nature, as part of the formal state education curriculum. Every 3rd grade class studies in California, studies science and nature during that 3rd grade period. They're also introduced to California Outdoor Bill of Rights. Over 11,000 participants have participated. So what we have tried to do is really reach people with chronic health problems through our hospital partnerships. We have tried to reach adults and families through Trails Challenge, and we have created the Kids Healthy Outdoor Challenge for the curriculum in the schools, bringing people, including, as you can see on the bottom of the slide, it's a booklet, and the kids go through the booklet and talk and learn about parks, this has actually been accepted by the education departments in our East Bay as part, again, of a formal curriculum. We brought in, like we did with health professionals, we brought in education professionals to work with us on this curriculum. So these are our practitioner efforts in the Bay Area. You can stretch, you can walk, you can run, you can do yoga, and this is something very different from a traditional park and recreation interpretive or visitor center program. And so this is still being adapted as we move along, but it has proved to be very popular. So I would be happy to entertain any questions, and I really am honored to be a part of this, and I really think that to preserve parks and nature, we have to bring everyone in that we can to see the benefits of parks, and health is such an important part of what we can do to do that. Thank you.
Thanks, Robert. That was fantastic stuff and lots of good practice, which I'm sure got people thinking, and a few are typing. Just a reminder that we'll answer questions as best we can. It's the easiest way to organise this sort of event. Okay, I'm going to hand on now to Joel, who has worked for Parks and Wildlife Finland since 2000 and is an expert on many things, as I've discovered over the last few days, but sustainability, management of recreation and tourism, national park branding, and the Healthy Parks, Healthy People Finland work that he's going to talk on now. He's also a member of the Help and Protect the Areas Commission of the EUROPARC Federation too. So over to Joel.
Thank you, Pete. Thank you, Pete. I'm going to talk about the health and well-being in Finnish national parks, especially benefits perceived by the visitors. And this is my the contents of my presentation. First, I'm going to talk about Healthy Parks, Healthy People Finland program, then visitor surveys, and finally I come to the perceived benefits of visitors. But let me start with a few words about what we do actually at the Parks and Wildlife Finland. To put our task really brief, we manage and protect Finland's most valuable natural treasures in a responsible manner for the benefit of people and nature. And by the way, this photo is from Pallas-Yllästunturi National Park, where we are at the moment, north from here. And it gives you an idea about the Arctic conditions and the extremely clean air we are breathing in here. And in a couple of weeks, it will look like this here with beautiful autumn colors. Metsähallitus is a state-owned organization managing a third of Finland's area, and Parks and Wildlife Finland is a unit of Metsähallitus. National Parks Finland manages protected areas and historic sites and provides free facilities for visitors. And Pallas-Yllästunturi National Park is here where the arrow is pointing. So we are here in Äkäslompolo at the moment. We have 40 national parks in Finland. And this slide gives you an idea about the increase of number of visits to national parks starting from year 2000. Both the number of visits and the surface area of national parks have been increasing a lot during that period. And last year we had 3.1 million visits to Finland national parks. In 2010, we participated the first World Congress of Healthy Parks, Healthy People in Melbourne, Australia. And soon after that Congress, we launched our first health program, which we called Health from National Parks. With that program, we took the health and well-being aspect as very important strategic approach at Parks and Wildlife Finland. And a couple of years ago, we launched an updated version of the program, which we call now Healthy Parks, Healthy People Finland. The overall goal is that Finland's diverse natural environment improves the health and well-being of its people. And if we open up a little bit that goal, it means that the Finns are active outdoors people who enjoy nature as an essential part of life. Social, physical and mental well-being has improved as a result of diverse nature and active connection to nature. We have divided the Healthy Parks, Healthy People Finland program into 3 themes. Each theme has several more specific objectives until year 2025 and very concrete actions for the next few years in order to attain the objectives. The first theme is from nearby nature to national park, with 6 more specific objectives. Well-functioning continuous green infrastructure starting from one's doorstep is a key element of this theme. The second theme is everyone outdoors, and it also has 6 more specific objectives. Everyone has equal opportunities to enjoy the outdoors is the key element of this theme. Outdoor recreation should be easy and fun throughout the year, for everyone, of course. The third theme is results based on communications and cooperation, and it also has 6 more specific objectives. Good communication in cooperation with the other actors in order to encourage Finnish people to get out in the natural environment is the key element of this theme. And if you Google Healthy Parks, Healthy People Finland, you will find this program easily and see more detailed information about it. According to our experiences at Parks and Wildlife Finland, a long-term and consistent visitor monitoring is a precondition for evaluation of benefits perceived by visitors. We have done standardized visitor monitoring, which means visitor surveys and visitor counting, almost 20 years now. We also have a database in order to analyze and manage a large amount of visitor information. This slide gives you an idea about our standardized visitor surveys. We try to create a as clear picture as possible. In 2010, we added questions about visitor spending effects to our visitor survey questionnaires. And 2014, we added questions about perceived health and well-being benefits. And nowadays, information like in this puzzle piece is collected and reported as a routine work at Parks and Wildlife Finland. This is an example from this national park, Lasilastunturi. A visitor survey was carried out 2 years ago, and these are the results. Well-being benefits perceived by the visitors are very high. 84% of the visitors agreed that the current visit to Lasilastunturi National Park increased their social well-being. 92% agreed that current visit increased their psychological well-being. And 93% agreed that current visit increased their physical well-being. So these benefits are really, really high. We can also report that national parks move people. For example, in Pallas-Yllästunturi National Park, visitors moved a total of about 10.2 million kilometers in 2017 by their own power, which means cycling, trekking, skiing, etc., etc. And this is roughly the same distance as 255 laps around the world, to make it more understandable. According to visitor surveys starting from 2015 to 2017, 87% of visitors to nature and history sites experienced that their visit had a fairly or very high impact on their health and well-being. And the average health and well-being effect of the visitors was 4.36 on a scale from 1 to 5. Those visitors also estimated their health and well-being effect to around 100 euros per visit, which is the median value. And these kind of magic numbers are very important for our organization, because decision makers and politicians understand numbers. They understand especially euros and pounds and dollars. This is an example from an open-ended visitor survey question from Pyhäluosto National Park. Spending time outdoors in a spectacular landscape helped me to put things in the perspective and appreciate nature and life in general. This sounds fantastic and beautiful, but decision makers still prefer numbers, and that is why we need to pay attention how to report the results of visitor surveys in general and the health and well-being benefits especially. At Parks and Wildlife Finland, we have done a lot of work on visitor surveys. We have created a new model for reporting summaries, for example. And nowadays we are aiming at very illustrative and easy to read reports. And by the way, these are working much better than 100 pages of tables and graphs and texts. So if you are interested about this report, for example, from Urho Kekkonen National Park, just Google Urho Kekkonen Visitor Survey, and you will find the English summary easily. So this was my presentation. For now, thank you very much for your attention, and I will hand it to Pete.
Thank you, Julie. I see we've got some relevant questions which I'll come back to at the end, but they're also relevant to Robert, I think, as well, and they'll be relevant to our next speaker, Carlos. And just to give you a background on Carlos, he's a biologist, has been working for the Provincial Council of Barcelona in the Natural Areas Department since 1994. He's also a lecturer, has written several books, and developed research and monitoring programs, GIS projects for land analysis and planning. And he's also actively participated in the successive action plans for protected areas developed by the EUROPARC Spain section of the EUROPARC Federation, which he was president of between 2013 and 17. And finally, he's also a member of the EUROPARC Federation Commission on Protected Areas. Carlos.
Thank you very much, Pete. Hello, everybody all around the world, and thank you for attending this webinar. This last presentation looks to provide some examples of experiences at local level that had been put in practice last years by the government of the province of Barcelona, then the Provincial Council of Barcelona, called Diputació de Barcelona. Just an overview of our territory to understand where we are working. The province of Barcelona is one of the 4 provinces of Catalonia in Spain, with more than 300 municipalities and more or less the same population than Finland, but probably in one out of 100 of the extension. So our density, our impacts, our dynamics are very high. But if we take a look to the size, the density, the number of inhabitants of the province of Barcelona, there are big municipalities like the same Barcelona around the coastal line, but at the same time we have half of the municipalities with less than 5,000 inhabitants. So all these municipalities depends very much on the support of the provincial council in many aspects of policies and management, like territorial aspects. And in this case, for 40 years now, the provincial council is giving support to municipalities in natural areas and in planning and management through mainly 2 different lines of work. One is to help municipalities to develop their responsibilities on land, on natural areas, through land analysis that gives us information for the best way of doing the regional and local planning. This means regional plans for natural, rural, agricultural areas, and at the same time information and advice for local planning. The second line of work started in 1972 with the first natural park in Spain. Is our network of protected areas that is this network is planned and managed directly by the provincial council together with municipalities. These are 12 protected areas with more than 100,000 hectares and more than 100 municipalities involved. And we have direct lines, of course, of planification, of management, for conservation, for public use, for socio-economical development in this network of protected areas. So, within this background, we started some years ago to involve in how from protected areas and how from planning and management of natural areas could have an impact on health and well-being of people, of citizens, as one more line of work in our day-to-day responsibilities. As has already been said, it's clear every day we have more evidences of the impact of natural areas, of different kind of natural areas on health and well-being of people through different mechanisms that I will not now go inside. And within this under this umbrella of different international initiatives, we started to develop the local initiative I will show you later. So some of these umbrellas have already been mentioned, like Healthy Park, Healthy People initiative, the international project under the umbrella of IUCN, how to improve health and well-being of people through these innovative approaches and recommendations developed by IUCN. The EUROPARC Federation approach is why this Commission of Health and Protected Areas was put in practice some years ago, and as well as some initiative of the Spanish section, like this is a compilation of different experiences from our regional and local governments in Spain. So we have different frameworks and different umbrellas under where we started to put in practice some experience in our day-to-day work in the province of Barcelona that I will just show you very quickly because we have no time to go in depth. I'm happy to explain you more things if you are interested. The first thing that I would like to mention is that inside of the county council we have a cross-cutting working group running for 5 years, more or less, about environment and health. And the leader is, of course, the Department of Public Health in the Provincial Council, but there are people from environment, from urbanism, from mobility, from roads, from different departments who share and who try to perform a collective initiative about health and well-being, for instance, related to mobility, to edification, building, and urban planification, for instance. This year, for the first time, we will have an assessment of the impact on health of urban planning in one municipality of the province of Barcelona. The study will probably be finished at the end of the year, and will be a nice example of how to deal with health under the urban planning asset. And this is an example of how we have communicated the toolkit that Pete mentioned through this network, this working group inside of County Council, for all the people dealing with health to have this information and to spread to municipalities and other ones. You will see some green labels here that are the different parts of the toolkit, of the checklist that Pete mentioned. So you will find the labels about this initiative, these experiences, to which part of the toolkit are referred to. Another experience more related directly to the network of protected areas was a study about the perception of the visitors of natural parks related to health and well-being, similar to what Joel was explaining now. This study was performed 3 years ago and asked the visitors about motivations for visiting the natural parks and about the perception after the visit. So almost 80% of visitors said that the motivation mainly was related to different dimensions of health and well-being, physical, mental, social, and 7 out of 10, more or less, recognize a big improvement of their health and well-being after the visit, and asked about what attributes of the natural park contributed the most to this sensation of well-being. Forests and landscape and silence, this feeling of peacefulness and silence, were the elements more mentioned by the visitors. So there is more information about different dimensions of this motivation of its perception. So if somebody is interested, we have some more detailed information. And of course, this is direct related to monitoring and evaluation of how planning and management of protected areas are directly related to health of visitors. So another example is how through our network of protected areas we try to push for local products, for local producers, for natural products, and we try to have healthy menus in all our facilities, giving restaurants and other facilities related to food, delivering products produced in the parks under ecological, organic formula, etc. So this is a way of through site management and through communication to help to support local producers, especially those following these organic elements. Two more examples. These are more related to public use. The first one is about accessibility to natural parks. We work very hard in this line since the very beginning of the network of protected areas, but now we have a big experience, and what we have done is to put all the offer of accessibility into our natural parks under an accessible website for all of kind of people, independently of the disabilities that they have. So we work very hard for having this accessible website with NGOs of associations of disabled people, blind people, or other kind of physical disabilities. And now it's possible to find all the offer to these people that usually do not come to natural parks because it's difficult to access. And they can find what we offer in terms of specific tracks, specific activities for them. So we have different lines of action. Some activities are especially prepared and developed for people with different kind of disability. But on the other hand, what we try to do at the same time is to support universal accessibility. So how to support groups with people they have any kind of disability to do all together the same itinerary, the same tracks, and we can do this through offering in our facilities, visitor centers, that the group can borrow specific material for having the same track, even though people have some disabilities, specific Joelette bikes or third wheel for wheelchairs. So with the final objective of reaching this universal accessibility. And we have programs and projects for doing the same for schools following our environmental education programs. Nowadays, we have almost all the materials for environmental education adapted for children with any kind of special needs or disabilities. So any group, any scholar group in the province can come to our natural parks and follow our environmental education, even though they have children with special needs, or even the full school is a special children school. And so finally, the fifth example is we are working right now to try to develop in depth related to health, especially plan and manage healthy paths, as well into two different lines of work. One is what we call in general healthy paths. So these are paths with special features. We have a standard about the land, the slope, shadow, water, signs, etc. to have this label healthy path, especially in peri-urban areas, with the purpose that are used for people that do not usually go to parks because are far away or the tracks are too difficult for them. So we try to do this in partnership with local health departments and municipalities, and they push and they advise people that normally do not walk in nature to use this peri-urban healthy path. We are now working hard with some municipalities with some pilot proofs, and fortunately in the next future we will have in many different municipalities. And the second one is more especially devoted to what's called forest baths. You know these Shinrin-yoku initiatives in Japan and Korea. So we are now developing a pilot project about tracks and activities in nature forests with different objectives. So from very urban forests, so trying to protect urban forests that are really well preserved with some signs of maturity for being used in a day walks for people living in cities, and then some other ones that can be reached by maybe 1 hour car in one of our natural parks, and these are one day activities. Another one that further away that are maybe weekend proposals, and in any case, depending on the owners of these forests, well preserved, well conserved, are private or public, depending on the NGOs working with us. So we have different approaches of how to integrate this in the territorial scheme, how we will manage, how we will ensure this economic return to the property, to the municipalities, and what's the best way of ensuring the benefits of these forests for health and well-being. So we'll try to develop different schemes of governance of for each of these forests, ensuring at the same time the conservation of these forests, because sometimes forests are not inside the protected area, and the conservation is not ensured because it can be cut. The benefits of timber are bigger than benefits, other kind of benefits, and so we need to develop schemes, different schemes in each case. So just to finish my presentation and to close this circle, what we try to do is to integrate all these experiences in our role of giving support to municipalities in planning and management of natural areas, and we use the scheme of ecosystem services and green infrastructure approach that now is increasing in Europe, because you know that through ecosystem services we can improve many different constituents of human well-being, and health is one of them. So through the GIS that we use in our day-to-day work, what we are doing now is to try to map different services and regulation, provision, and cultural services that are directly applied in strategic planning, so both at regional and local level. So at the end, what we want to have, is possible, is that in any initiative of land analysis or land planning at regional or local scale, that health and well-being will be taken into account through trying to have information about these services that natural areas can give to people, and to use it to ensure that in any kind of planning these aspects will be taken into account, and at the end will be in the benefit of people living there. So many thanks for your attention, and we are happy to answer your questions. Thank you.
Many thanks, Carlos. Very excellent presentations. Thanks to all three speakers, which illustrate, I think, some of what we've been doing and trying to promote through the toolkit. We have a wide range of questions. This is where the webinars get fun. And I'll try and grade them. I think I've got 5 groups of questions, 2 specific ones to Robert and to Jolie, and then some general ones, which I think I'll throw out to all the speakers. So I'll start roughly in the order that we went with, if that's okay, and Carol can keep me right on this. So there was a question to Robert about prescription, and what he meant by prescription, and how he's managed to influence, I guess, what we're calling medical pathways in this area, or in his park area. So Robert, do you have some commentary on that, please?
Yes, thank you. What we have done, the different hospitals, to have practitioners, specifically doctors, to actually give a prescription of recovery to go on a walk. And so the doctor, and the national parks have US of A have done a lot on this. So parks prescriptions are something embraced by the national park system as well. And it's as simple as, rather than or with a prescription of medicine, the doctor says, here's a map, here's a bus line, here's how you get there. We would like you to take a walk in this park once a week. We'd like you to attend one of the HPHB programs, even where there may be a stretching exercise. So what we have done is to work with the hospitals to actually write a prescription. And again, National Parks has really done a lot on this, and we have followed in suit to do the same thing. So it's very simple, trying to reach out into the hospitals or health agencies and say, I have a wonderful story of a person who had a heart attack, and the doctor says, you need to walk every day as part of your recovery, a little bit at a time, and a very specific prescription of how much, how often. And with that, here is an introduction to these 73 beautiful parks that you can go to that are nearby. So that's the best, simplest example. This person, who again had a very bad heart attack, actually now has become one of the biggest promoters, of course. You can't stop him from getting out into a park. And he calls me even as a general manager and say, I was in this park today, and this is what I saw. And it actually builds. This person believes that the park's prescription saved his life. And I think that's just a wonderful example. But they're doing the same thing with children as well, that children that are obese. One of the big challenges for obesity is a person who's having such trouble with managing their weight feels overwhelmed and frustrated, and it is really hard for them. So what we have also created is a system of easy, flat walks. You don't have to climb a mountain. You don't have to be vigorous in your physical ability, but you just go for a walk. And we have even worked with the doctors to say, don't say hike, because that turns children off who are not interested, but say, just go on a fun walk with your friends. So those are examples of prescriptions, but they're actually coming through medical offices.
Can I probe a little further? Certainly, I think elsewhere, we have struggled to convince GPs, and GPs in the Scottish context are private individuals, private businesses, to actually prescribe, either in a very formal medical sense, a pathway sense, to things like health walks, or in a wider social prescribing sense. Some do, and some don't. And it seems to be, in terms of the perception they have of the evidence, and also the sort of their worldview almost about the role of medical science and the role of nature. So have you got any advice about what worked in terms of talking to GPs and hospitals, as you referred to?
This is Robert again, and I think it's that you have to have a direct contact with a leader or a doctor who really is motivated, because they have to work within their own system to get their administration, their administrators to support this. And we have been lucky to have a handful of very specific doctors who are very motivated on this.
Excellent point, and it probably addresses one of the other questions we'll come to about the challenges of working with the health sector. So the importance of champions within the health sector, I think, is what I'd certainly underline. I'm going to ask Jolie now to answer some of the issues about the evidence base, and particularly how we turn visitor perceptions into economics, and also validation of the perceptions in terms of medical impacts by the health world.
Okay, thank you. First of all, we defined that or developed that method together with the researchers from all Deaconess institutes. So we didn't do that by ourselves, because we know how to meet visitors. We have done visitor surveys for almost 20 years now, so we know how to ask questions from them. So we made good cooperation with the researchers, and we have to keep in mind that these are the perceived benefits by the visitors, not the perceived benefits by studied benefits by the doctors. Mm-hmm. So there's a big difference between that. And there's a lot of scientific evidence, and the results goes nicely hand in hand with these results that people think that visits to national park improve their physical well-being, social well-being, and psychological well-being. Okay, and our role is to, it's good to keep clear in mind, our role is to get people out into natural settings. We try to encourage people to go out into nature, and that's our role. Then about the calculation, we have a question in the visitor survey questionnaire where we ask a visitor to put monetary value on the current visit to national park, for example, and we in monetary terms, of course, and we give some kind of ideas to the visitor. For example, what is the price of a cinema ticket or day in a spa or a holiday trip, so they can compare it, that experience, and those numbers are really high, so exceptionally high, and we are calculating quite moderately the median value, which is the middle value. The average value is much higher, and we are very cautious. It is perhaps even the underestimates of the value perceived by the visitors. But of course, we realize at the same time that it's not because they don't have to pay anything for the visit, so it is not reality, but it gives us an idea about the monetary value as well, which is very important. Yeah, but it is not real. They don't have to pay in real life, but it gives us an idea about that.
Okay. Thank you very much. We won't have a debate about contingent evaluation, which is, I think, where you're straying into. But obviously, one of the things for me in that is around partnership. That actually you're working at all levels of the health sector here, and not just at the end of the product. So that's a key message there. From Scotland's perspective, I guess there's two things I would just observe. One is there are quite a few specific studies around the impacts where there is quantification. Random control trials are difficult in this area, but there have been some studies around that. And from a more general health promotion perspective, and you get into health economics at this point, then the impacts at a population level can be quite small, but actually the cost of them is very small in health terms. And also, we're delivering more than just health benefits here, so there are multiple outcomes. So in that sense, I think the sector can be quite relaxed about the economics of what we are doing and the contribution to health. But we still need to work on the evidence base and the what works evidence. So that, I guess, is a final sort of more general question here. I don't know who wants to pick it up. So, how do we actually demonstrate what works in practice? I think there's a query about we have lots of studies, we have lots of evidence, we have some data. But how do we know we're doing the right things with the resources that we have in protected areas and national parks? Does anyone have a view on that around the table? Perhaps, Bob, I can direct that at you, and wonder if you've done things like demonstration projects and evaluation, etc.
This is Robert. One of the things I've done is actually hospital to do a health study. We actually monitored with a doctor who's been in charge of this program at Children's Hospital the actual blood pressure. And did a health analysis, weight, blood pressure, stress factors, as some of these young people started to use the parks more. It was a preliminary study that was completed We are looking for funding to expand that, and it looks very promising to go to the next steps. But I think it is important, like with the in-park surveys, to actually be able to do something within the medical community and publish that data. Just like we used an external financial accounting consultant firm to do our economic study, we need to do more studies in cooperation or on the lead of medical agencies. I think that data is really critical.
So to add to that?
I would add that in my opinion, the best demonstration is how visible about it. So, and then try to put their opinion into understandable way, and that's what we've been doing.
Okay.
Just to add some experience in our case, in addition to all that, I think for the first time in the Mediterranean context, we are partners of a project that try to look for concrete mechanisms of action. So starting a project with volunteers, dealing with them in the Mediterranean oak forest, with a medical team, and monitoring different kind of parameters related to health, depending on the time of being there, if there's any change of microbiota, immunology, answer, and all this. And we think that the medical sector will appreciate very much. They are implied and they can recognize concrete mechanism of action. It will be probably more easy for them to have this as alternative complementary therapies to other ones. So I hope that next year we'll have concrete mechanisms of action of this contact with nature. That we know that the benefits are there, but probably we need to know more how these benefits get the people first.
Okay. Thank you, Carlos. In time available, I'm going to focus now on two sort of general questions and try and have some discussion of them. One is about financing this work. I think several of the participants have asked the question about, well, with budgets are declining in most European countries, and this is new work that we're being asked to do, and new expertise we're being asked to generate for ourselves here. So, have we got examples around the panel here about how we generate the funding for it? Is it from our existing budgets, so we're giving up something to do this work, or are we financing this in more creative ways? So I'll go to Bob first, and then we'll come back.
Yes, I think the importance is that the partnership we've been able to do with Kaiser Permanente, the hospital, large hospital medical programs, many of the institutions and public bodies within the Bay Area are part of the Kaiser Permanente hospital groups, and they actually have helped fund a lot of the work we're doing. So they are actually paying for the publications, like the Children's Healthy Children Outdoor publication. They paid for the printing of that. They're a regular partner in trying to look at grants from health organizations is a challenge, but once you get in that door and get an advocate, it's very, very helpful. The majority of what we're doing is very low cost. Most of the promotion is through our own website, very accessible. I really want to emphasize the change because of technology, and obviously we're in the Bay Area with Silicon Valley and all the technology, but people are accessing our system through our website. It is a tremendous growth. It's very fast and so very accessible. So there's so much that they can see, including everything I've shown today and our economic studies, all posted on our online ebparks.org. And so that has opened the door to a lot of people without having to spend money to reach out to them. It's really a very simple way of reaching people.
Interesting twofold answer. So yes, you have been drawing down money from the health sector, and that's certainly our experience in Scotland, although there are definitely challenges in there. And the other one is about of our interventions and how a little can go quite a long way here. Carlos, do you want to add to this, or should I? Yeah? Okay.
In our experience, so I agree that many activities are low cost. Some things need big infrastructures, of course, need big investments. In our case, came from, adapted paths, specific materials, or specific resources for the scholarships adapted to different needs. And this was done through public budgets or through agreements with big enterprises and banks which collaborated with us and referred to current projects we have aligned with private forest property owners, that we have different mechanisms through NGOs that people can pay a guidance, and part of the entrance, let's say, for this guidance will go back to the forest owner, because at the end we want that these benefits are bigger than benefits from timber. So we prefer to have the forest on step instead of logging.
Okay, so two further things there. One about charging, and one about private or commercial funding, sources of funding. Where
in the case of EUROPARC Spain, our section has an agreement with a private insurance enterprise that wants to show different adapted paths and healthy paths, and with an agreement with the Spanish EUROPARC section, EUROPARC Spain, through our website. People can find, especially the customers of this private insurance enterprise, but any citizen can find healthy paths all around Spain, all around protected areas in Spain. So there are private enterprises that are really interested in this.
Okay, I've been given the 5-minute bell, so I'm going to ask one final question to everyone, and we'll wrap it up then with some closing announcements. So the question I'm going to ask is a general one that we've had various people say about what are the issues and opportunities to engaging with the health sector specifically. So this is how do we get greater alignment between what we're doing in the health sector. So one issue and one opportunity from each of the speakers would be good. So I'll go to Carlos first, and Joe. Okay, I'll go to Bob first, and just one issue, Bob, and one opportunity that you see in your.
It's important that the basic core values of a national park or state park system are to keep those parks safe and clean and manage those parks. So having a partner on innovation like a health agency or in our case, our NGO or nonprofit, I think is essential to push the envelope. Otherwise, the government agency will go back to its core mission, like stretching a rubber band. So I think the opportunities are to look for partners. That partner could be another agency, could be a health system, could be the private sector, but working through a nonprofit partner or a foundation really is helpful, because when you're trying to stretch the traditional management of a large park system, it's always going to go back to, are we doing our core mission? So I think partnerships are essential in doing this, and that's why our Regional Park Foundation has been really the lead on going after money, going after some of the nonprofits, but also the most of the hospital systems have a nonprofit arm to promote health. And I think that's where you have to find a leader, you have to find somebody to do that. In our case, many of these situations have partnerships have come from somebody who's a park user and excited about it and wants to get more involved and get their company or their agency or their health service institution more involved. And it really takes that kind of personal leadership.
Good answer as well. Zola, do you want us to comment on that? I think I'm going to run out of time. One issue and one opportunity for meta-analysis.
Okay, it is obvious that we need good partners and partnerships. Without them, we cannot do it by ourselves. And one innovative idea for us is to do cooperation with health centers, especially with small babies. So in Finland we have that baby box. We could put information about health benefits of nature into that box. So in order to encourage parents to go nature with their small children.
Okay, thank you very much. For me, I'll just take chair's prerogative and say the issue for me is around, I guess, demonstrating what works in practice and having the demonstration projects set up and evaluated properly. And I think one opportunity that we've talked about is finding champions in the health sector that we can really work alongside with. I think Eric, also I'll just say about Eric's point that's flashed up about the medical culture that we have, which is very drug orientated, and we need to work with doctors, the GPs, and also perceptions of patients about what works. But I think Eric will always tell us that whenever we go into a forest or into nature with people, they do get the health benefits. So we have an open door, I think, there. So I think I need to wrap up now. I'm just being told all further questions, if there are further questions, you can direct them to any members of the panel, but can you do that through the email office@europarc.org. So that's office@europarc.org, and we will put you in touch directly with the speakers. Sorry, it's just at the bottom. That has been a really useful session. Do I hand back? Oh, there we go. There's the office@europarc.org email address. If you want to get in touch with us, use that address, please. We would still like discussion, feedback, examples of the toolkit. I think I've taken away a few things today that we should look at in terms of case study material and clarifications. That's been really helpful. And I think that's it. So I think, do we hand back to Barbara at this point, or is that it? That's it. So au revoir, and thank you for joining us, and we'll hopefully see you all again before too long. Final plug, EUROPARC's conference is in 2 weeks' time. There is a workshop on this topic. If you are there, please come and join the workshop. If you can't join the workshop, please see some of the people on the commission who will be at the conference. Come and find Carlos and Zoe in particular. We'd love to speak to you. Okay, many thanks, and have a good evening.
Afternoon or morning. Thank you very much to all the speakers, and let me just conclude by inviting you to our next EUROPARC webinar. We will follow partly the same topic. We'll be looking at accessibility and inclusion of people with disabilities in protected areas, and we'll hear from 2 case studies from the UK and from Germany, and also share with you a very interesting manual produced by EUROPARC Germany. So I hope you will get all this information in your email address, and also from tomorrow onward you'll be able to download the presentations that the speakers shared with us today, and also watch or hear again the full recording of this webinar. I wish you all a very nice evening or a very nice day for those who are connecting from overseas. And one final link for you all, if you want to join us in 2 weeks' time in the Cairngorms National Park, you're very welcome. We will have our annual conference there. We have over 350 people joining us, but registrations are still open, so you can still book your place. The website is www.europark2018.com, and I look forward to seeing you all there. Thank you once more on behalf of the EUROPARC Federation, and see you next month. Goodbye.